Lots of patients ask us how they can improve their natural fertility. Well, there are lots of different things you can do. So the first thing is weight. So we know that women who are overweight have more difficulty with getting pregnant. Not only that, but they also have higher risks of miscarriage and having difficulties in pregnancy themselves. So complications like high blood pressure, diabetes, cesarean section rates are higher, and having birth trauma in the baby as well is definitely an issue to think about. Stillbirth also is a problem, and a risk of congenital anomalies is associated with being overweight or obese. So we'd highly recommend that women who are overweight or obese try and lose weight, and that's through diet and exercise. Fad diets are generally not a good idea. They're not good for long-term health and well-being and maintaining a weight. A slow, steady decrease in weight is the best approach. And normal amount of physical activities, so at least 3 times a week of some sort of physical activity, will help you to lose weight as well. For women who are overweight and not ovulating regularly, losing weight can have a significant impact, and even losing just 5% of your body weight can help induce ovulation once again. So that's very important. If you're having difficulty, please ask your doctor, because there are professionals we can refer you to that can help you with a weight loss program. On the flip side, being underweight can also be a problem. We know that women who are underweight have more difficulty achieving pregnancy, and also can have more complicated pregnancies as well, such as preterm delivery. This is not only a problem for women, but also for men. We know that men who are overweight or obese also have higher risks of infertility and problems with semen analysis and other associated difficulties. So it's also important that men lose weight. So another thing you can do to optimize your natural fertility is to quit any really bad habits. So those include smoking. We know that cigarettes have a negative effect both in men and women for fertility. It can make achieving a pregnancy much more difficult for women and can affect their ovarian reserve. And for men, it can definitely affect the sperm parameters and can have a lasting effect on the sperm. So we highly recommend quitting smoking, and using a nicotine replacement therapy or other medications is safer than continuing smoking for your long-term health and well-being. And we know that smoking in pregnancy is also associated with lots of complications in the pregnancy for childhood asthma as well. So we highly recommend that couples seek help in trying to quit smoking. Another bad habit is excessive alcohol intake. While the studies on alcohol intake in couples trying to conceive are quite variable, we generally recommend that women limit themselves to no more than 5 drinks per week, and men to no more than 10 drinks per week when you're trying to conceive. Of course, for once a woman achieves a pregnancy, we know of no known safe limit of alcohol intake in pregnancy, and so we generally recommend that women abstain from alcohol use in pregnancy. There haven't been a lot of studies on the effect of street drugs on couples trying to conceive, but we generally recommend abstaining from all street drugs. What we do know from marijuana use is that it can have a negative effect on sperm quality and motility, and that can have a lasting effect up to 3 months. So we do recommend that men abstain from using marijuana while trying to conceive. We also recommend that women limit their intake of caffeine while trying to conceive. While the studies are also variable on this account, we do generally recommend staying under 3 cups of coffee a day. So you don't have to give up caffeine altogether, but certainly limit the amount you're taking in. So another thing you can do to optimize your fertility is thinking about supplements. So folic acid is probably the most important supplement that any woman can take when trying to conceive. Taking folic acid can help reduce the risk of congenital anomalies, and specifically an anomaly called spina bifida, which is the spinal cord abnormality in the fetus. So we recommend that all women be taking folic acid. Another supplement that your doctor may recommend to you, but not in every situation, is something called coenzyme Q10. This can help increase the energy in aging eggs. It's typically recommended for older women. Men might sometimes also be recommended to take some supplements. Some of the studies that have shown that a multivitamin specifically for male fertility can improve sperm parameters, and so we might recommend that you take that. That generally includes vitamin B9, B12, vitamin C, selenium, and zinc, and as well as vitamin E. Another important thing that men need to think about when they're trying to conceive is avoiding hot situations. So The scrotum has been designed for the testicles to be in a cold environment, and that is where sperm survives the best. And when it's in a hot environment, it doesn't survive as well. So this is the time to avoid wearing the tighty-whities and to avoid hot tubs and saunas, as it can have a lasting effect up to 3 months on the sperm quality. Another thing to consider in couples who are trying to conceive is lubricants. So while lubricants can be very important, particularly for women who have pain with intercourse, in helping reducing the pain and therefore helping you get pregnant, they can also have a detrimental effect on sperm. So typical lubricants that you buy from the pharmacy can have negative effects on the sperm. So we generally recommend you avoid using those. Ones that have been shown to be safe include mineral oil, canola oil, and there are some specifically marketed for patients trying to conceive. So avoiding stress is also very important when people are going through fertility treatment. And unfortunately, going through fertility treatment can provide a lot of stress for couples. So please let us know if you're suffering from a lot of stress. It's very, very common, and it's important to help reduce that level of stress. We have a social worker here on site that can help you manage with fertility stress. That is her specialty, and we can refer you anywhere else if needed. Also, remember, this is an important time for you and your relationship, so make sure you take time for yourself, do the things you enjoy, and make sure you take time for each other as well. There are different options for managing stress apart from using a social worker. Those include acupuncture, which has been helpful in some patients undergoing fertility treatments. Some people might find seeing a psychologist or seeing a sex therapist helpful as well, so please let us know if you'd like a referral for any of these. The last important thing to think about is timing. So the fertile window for getting pregnant is actually very small. It's the time just before ovulation, the 1 or 2 days just before it is the most fertile time, and very important to have intercourse during that time. So getting the timing down is very important. What we recommend for couples who have regular cycles is to look back at how often your cycles come and calculate when the ideal time to have intercourse is. For a woman with a 28-day cycle, usually ovulation will occur on day 14, so the most fertile days will be the couple days before that time. So we recommend starting to have intercourse on day 10 and then having intercourse probably day 12 or day 14 to cover the bases. Every second day is perfectly adequate, and every day is fine too. So even if you are doing other fertility treatment with us, we do recommend thinking about all these different aspects because it can certainly have an impact on your fertility.